Before we start, I want to introduce myself first. My name is Zoran, and I'm currently in English 107 at ASU with Miss Ike for this project, and I have chosen a TED Talk by Michael Botticelli. It didn't take me long to find the video, as the topic of substance use is what I'm always interested in. And the reason why I'm interested in it is because I've seen someone I love was struggling with the issue, and he still is. So it caught my eye when the speaker said, somehow we believe that we are less deserving of care and treatment. And I couldn't help thinking why. And I hope my research on this topic can help everyone who is experiencing substance misuse. And I hope they can get help and let them know that they are not alone. Meanwhile, people around them would acknowledge the pains those patients are going through and be there for them. Before introducing my research question, I want to know some things from you guys. How often do you get negative feelings? And how do you cope with them? Also, this is my dog after he took medicine, and this is how he really is. And after thinking of those two questions, I will show you some other pictures. And what is the first thing that comes to your mind when you see these? Some people might say they feel danger, unsafety, and possibly life-threatening, and some people may say this is really upsetting and depressing. However, this is what most people with substance use are suffering. And there is more under this issue, as what we can see is not everything. The central question guiding my research is how does physical damages caused by substance misuse lead to mental illnesses? To begin, I like to share data from 2020 that illustrate the severity of the substance misuse crisis. When I first encountered this data, I was stunned. The reality it represents is devastating. It's heartbreaking to consider the number of families that have been shattered by the loss of a loved one, and it is this profound human cost that we must confront. This presentation will be divided into 3 parts, as each of them has connection and will be confusing if I put them together. The first part will explore the relationship between mental illness and substance use. The second part will examine the dual impact of substances on both psychological and physiological aspects. The third part will address the physiological relationship between brain injury, substance use, and mental illness. Gradually, I will explain in detail the relationship between these 3. First of all, we'll be looking at the connection between mental illness and substance use. And after I study all the sources, this is a conclusion I come up with, which is mental illness makes someone likely to experience substance use, as well as someone who experiences substance use is likely to develop mental illness. This table displays the 3 most prevalent substance uses: tobacco, alcohol, and cannabis. As shown, the corresponding rates of depression and anxiety associated with those substances are extremely high. However, we must consider this question: are substance uses limited to these few? The answer is no. Substance use encompasses the abuse of any substance such as opioids, cocaine, and heroin. Now let's explore the answer to these questions. While the 3 substances highlighted in the chart represent those most commonly encountered in our daily lives, what about substances with stronger effects? Could their impact on individuals be even more detrimental? Now let's take a look at this image, which I pulled from data-driven discovery of causes, treatments, effects, and abuses. When we focus on the right side, we find numerous factors that can lead to substance use, like social and economic, treatment, disease, and individual factors, whether from physiological or psychological perspectives. And the individual's mental health is also shaped by the people and events they encounter in society, influenced by their social environment. Even seemingly insignificant events in daily life can become the final straw that breaks someone's spirit. For example, someone who is broken just happens to know that he or she is diagnosed with severe disease, or a teenager who is being bullied at school gets scolded by parents every day after he gets home. What is the most accessible stress relief method for these individuals? It is using substances to release their pressure with minimum time and cost. Now, when we turn to the discussion of substance use and its physiological and psychological impacts, I've summarized 3 points. Substance use directly affects physical health. Substance use directly leads to changes in behavior. The physiological and behavioral changes resulting from substance use indirectly impact mental health. Now let's examine this table. When individuals struggle with substance use issues, regardless of the specific substance involved, impacts their behavior. For instance, some are more likely to commit domestic violence while intoxicated. Others may experience hallucination after taking drugs, harming themselves or others, and some sustain injuries due to impaired physical functions caused by drug side effects. Even though some people desperately want to control their actions while still conscious, the power of chemistry far outweighs willpower. After discussing physical harm, let us now turn to psychological harm. When a person acts against their own will, what is their initial reaction? Most will likely feel regret. This is followed by an endless stream of self-reproach and self-doubt. However, some individuals may develop thoughts of harming themselves or others, as this serves as a way for them to elevate their own stress. What does constant self-doubt and self-reproach lead to? It leads to increasingly low self-esteem and dwindling self-confidence. A lack of self-acceptance causes people to lose interest in life. Day after day of suffering disrupts their sleep, and sleep quality directly impacts one's emotional state and ability to function. Now let's shift our focus to the relationship between brain injury, substance use, and mental illness. When we mention brain injury, I believe most people are familiar with traumatic brain injury. For many, it is the first term that comes to our minds, right? The data in the figure provides a clear illustration of how TBI leads to dependence on substance, and this only covers a portion of the substance involved. For those who are unfamiliar with TBI, I would like to provide an introduction first. What is TBI? Traumatic brain injury can result from external factors such as blows, impacts, or penetrating injuries that disrupt brain function. But is that all there is to it? I used to naively believe that external force was the sole cause of TBI, but turned out that's not the case. Substance use can lead to TBI as substances similarly impair normal brain function. Regarding this topic, I want to focus on two groups for discussion. The first is youth. After seeing this data, it gave me a feeling that this is really one of urgent convictions. It is not just a dry number, it is the life of kids who have experienced TBI being severely affected. This chart provides a more intuitive explanation. Among all these age groups, adolescents surprisingly account for the second highest proportion. This naturally leads us to consider what factors in their lives might drive their choice to engage in substance use, which brings us back to the diagram we presented earlier. They might be subjected to bullying at school, their parents might also struggle with substance use issues, they may feel neglected or emotionally oppressed. After examining TBI among youth when discussing TBI, I believe one group that cannot be overlooked is veterans. The physical assaults veterans endure in the military and on the battlefield are the most significant, directly contributing to a higher rate of TBI. The most immediate impact of TBI is the tangible physical pain it inflicts. Psychologically, TBI can lead to mental health disorders, with PTSD being the most common one. PTSD, in turn, can trigger other secondary psychological conditions. Individuals with PTSD often exhibit behavior traits similar to those with many other mental illnesses, which can sometimes cause people to overlook the harm PTSD inflicts. From the perspective of medical science, research on the brain in this diagram demonstrates that psychologically, the brains of individuals with TBI differ from those of healthy individuals. When we conclude, we see the profound and cyclical connection between brain injury, substance use, and mental illness. This is not a simple correlation but a complex interplay where each condition can be both the cause and a consequence of others. An individual suffering from mental illness may use substance for self-treatment, which increases their risk of accidents and TBI. Conversely, a brain injury can alter cognitive function, predisposing a person to both substance use as means of coping and the development of new mental health disorder. Therefore, recognizing this triad is not merely an academic exercise, it is also a clinical imperative. Supporting them is essential. These individuals operate under significant pressure, confronted by relentless criticism, discrimination, and stereotyping. Helping those with substance use disorders begins with our own awareness and extends to raising the consciousness of our community. By advocating for change, we can push our social system to recognize this is a critical health issue. People affected by substance use deserve care and treatment, not stigma. They deserve to be seen as patients battling a disease just like any other. In the end, I want to express my thanks to my fellow group members. This project would not have been possible without their dedication and collaboration at every stage. And thank you all for listening.